we're going to demonstrate how to use posterior tibial nerve stimulation on the ankle in pediatric patients. So this should be the unit that you would have purchased. It's the 10-7000 unit available online. You should also get some alcohol wipes, but just making sure that the area where you're going to put the stickers on should be nice and clean. And then also these electrodes. The electrodes that the unit comes with are fairly large, so I recommend these smaller electrodes that are better placed on the ankle so they're not overlapping. So first what we're going to do is make sure that your unit has the battery placed on the back. And so you just open up this, the back of the machine, making sure that the battery is appropriately placed, and it's just a 9-volt. Essentially what you're going to identify here are the 2 channels. There are 2 channels on this machine, number 1 and number 2. I typically just use number 1, and that's where you would apply the lead from on the first one. When you open up the little kind of cover, essentially by turning it on, you should hear and feel a click. And so that automatically turns on the machine. I would recommend not placing any of the leads on the patient currently. So what we're trying to first do is to identify and set the machine to the proper coordinates. So currently it's on the normal mode. If it's not, you can use the mode button to choose that particular setting. The next thing that you're going to do is change the width to 100 milliseconds and 10 hertz. So you do that by pushing the set button, and you can adjust the number with these little arrows to 100 millisecond width. And then when you are satisfied with that, you go to the rate and you can adjust the rate to 10 hertz. The following thing would be setting the time. So you want to set it to approximately 20 minutes. And so again, you push the set, and then you can adjust the minutes based on the up and down buttons. And when you're satisfied with that, then you are all set with that. When you're all done with setting up the machine, you can turn it back off. And then what I would do then would be to connect the electrodes to the leads here. And so you notice that there is a red and black lead here. You want to connect the red electrode, to one of the leads, and the black one to another of the leads. And these electrodes are reusable. If you need more, you can just call our office and pick them up at the front desk, or you can purchase them on the web as well. They are very sticky, so definitely reusable, but best being used after the skin is cleaned well, either with an alcohol prep pad or just kind of after a shower. So the recommendation is to use it twice a week approximately, and you can always use it more. You can always use it every day if you'd like. But again, after bathing is the easiest, but if not after bathing, then using an alcohol prep pad to prep the skin and clean it. So where we're going to apply the electrodes would be on the inner part of your ankle. So this is my left ankle. There is a nerve called your tibial nerve located on the inner part of your ankle bone here. So that's your ankle bone, the inner part of your ankle bone, and there's a nerve that kind of runs up here. And you want to make sure that this area is clean, and that's where you're going to be applying the electrodes. So you will be attaching one of the electrodes on the inner part of the ankle right behind the ankle bone. And then you will be applying the second sticker right adjacent or underneath that ankle bone. So again, just to kind of show you, this is the ankle bone. You'll be applying one of the stickers behind the ankle bone and one of the stickers below the ankle bone. I then will turn on the machine, and at this point I am not feeling anything. I'm going to take off my sock so you can actually see my toes, and I will be gradually increasing the intensity of the machine to a point where I start feeling a little bit of tingle, starting to feel just a little bit of tingle to my foot, almost like my foot is asleep. So I'm feeling that now. And then I'm locating my toes, and you can actually start noticing my toe moving just a bit. It's hard to appreciate, but when you're seeing it in person, my large toe is actually twitching. So that's a good place to start, and you can always increase the intensity over time. So on the machine, on the first channel, that intensity is approximately 3. That's the little mark, and so we're at approximately 3. Over time, you can always increase the intensity, obviously the higher the intensity, the more efficacy, but it really depends on the patient's ability to tolerate the intensity. So at this point, we're just going to relax. It's counting down, already counting down from the 20 minutes. And once the timer is up, it will beep, and then you will just then proceed to turn off the machine. And then you can take the electrodes off, put them back onto the clear backing, and then use it again in a couple of days. The other thing to remember is that you can always alternate ankles. So if today I'm using my left ankle, the following time that I'm using it, I'll use it on my right ankle, and just kind of switch back and forth. If there are any questions, obviously you can reach out to our clinic here via my chart or our phone number, our clinic phone number, and be glad to assist you in any way possible. Hope everything goes well with using the unit, and best of luck. Bye-bye.